Hello, I'm Dr. Collins, and in this clinical examination video, we will explore a key upper motor neuron finding, known as Hoffmann's sign. If you're unclear about what upper motor neuron or lower motor neuron lesions means, don't worry. Just consider watching one of our previous videos, which summarizes these very tricky concepts in just a few minutes, and also demonstrates the Babinski sign, which is often considered to be the lower limb equivalent of Hoffmann's sign. Couple of key conditions that can cause a positive Hoffmann's sign include cervical myelopathy, often due to degenerative arthritis in the neck, multiple sclerosis, ALS, cervical spinal cord injury or trauma, for example after a road traffic accident, as well as brain tumors or a stroke. In order to perform Hoffmann's sign, support the patient's hand, for example using the edge of a desk or examination table. Then hold and stabilize the middle finger at the distal phalanx. Ask the patient to relax their hand completely. Using your thumb or index finger, briskly flick the nail or terminal phalanx of the middle finger downward, allowing it to rebound into extension. In the meantime, observe the patient's fingers carefully. A positive Hoffmann's sign is when this maneuver produces involuntary flexion and adduction of the thumb and index finger. Before we close, a quick word on clinical value. Hoffmann's sign has a low to moderate sensitivity of around 60% and a specificity of approximately 50%. What this means is that it can aid in screening and support the diagnosis of an upper motor neuron lesion, but clinicians should not rely on it alone to confirm or exclude cervical cord compression. It's also worth noting that systemic disorders such as MS tend to produce bilateral positive Hoffmann's sign, whereas structural lesions such as tumors may produce a unilateral response. Also, up to 3% of healthy individuals in a population may demonstrate a positive Hoffmann's sign without any underlying neurological pathology. Thanks for watching. If you found this video helpful, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical examination videos on our channel. Good luck!